วันนี้มีผู้ป่วยยืนยันเพิ่มจำนวนทั้งสิ้น60รายนะครับ
นับเป็นลำดับที่722ถึง827
On January 12, 2020, Thailand reported the first case of COVID-19 from an individual who traveled to Wuhan, China. It was the beginning for Thai people to be concerned about outbreaks of COVID-19 after it had been affecting many regions of the world. Meanwhile, medical teams around the world put effort into preparation in order to handle the situation.
ผมคิดว่าเหมือนกันทุกแห่งเนี่ยคือเราก็สนใจเพราะว่าพอปลายปีที่แล้วเริ่มมีการระบาดที่อู่ฮั่นทุกคนก็มีความรู้สึกว่ามันจะมาเมืองไทยไหมแต่พอเดือนมกรามีคนแรกติดในประเทศไทยแล้วก็เริ่มเห็นถึงการระบาดค่อยๆเกิดขึ้นมีการตั้งศูนย์บริหารจัดการ situation ของโควิดเนี่ยแล้วก็จะมีหน่วยงานต่างๆเข้ามาอยู่ภายในศูนย์นี้ควบคุมทั้งในเรื่องของสินค้าไม่ให้ขึ้นราคาเรื่องของอุปกรณ์ทางการแพทย์เรื่องของมาสก์เรื่องของอะไรตามอยู่ในศูนย์นี้ทั้งนั้นหลังจากนั้นก็จะเริ่มมีการประสานงานกันในระหว่างหน่วยงานที่เกี่ยวข้องคณบดีคณะแพทย์ทุกคณะที่เกี่ยวข้องประธานราชวิทยาลัยแพทยสภาแพทยสมาคมกระทรวงสาธารณสุขตั้งแต่ปลัดกระทรวงทั้งหมดที่ต้องประสานงานรวมกันทุกคนรวมกันได้จริงๆ
Being the wisdom of the land, Mahidol University promptly takes part in the fight against COVID-19. With over 130 years of experience, starting from founding the first medical school in Thailand and continuing to provide knowledge in medicine and health sciences, producing healthcare professions, and developing medical innovations. These are invaluable for the fight against COVID-19. Under the circumstances that Thailand is facing with the emerging disease, the opinions of academic sectors, including from Mahidol University and many leading organizations, significantly influenced Thailand's policy and measures against the COVID-19.
At that time at our hospital, we set up the so-called upstream strategy and downstream strategy. We sent our team to join the committee of both upstream and downstream strategy. The downstream strategy arranged by the Ministry of Public Health. The downstream strategy means how to reduce the mortality rate, how to improve the discharge rate, reduce the number of admission, the mortality rate. So it kept talking about the PPE, the N95, the drug that kill the virus. They talk about all of this. At the same time, CILA decided to move to do the upstream strategy. The upstream strategy is to reduce the number of new cases. We suggest people to stay home, to use the face mask, to clean their hand, to do physical distancing. We have done a lot of clips into the YouTube. We start into the social media, asking people to do what we suggest. At the same time, we explain them the reasons. If you can reduce the number of new cases, there will be a reduction in number of patients need the admission. So it means the resource that seem to be lacking will be enough to be used because the number of cases admitted in hospital seems to be decreasing.
Around mid-January, there's an announcement of the genetic coding of this COVID-19 virus. We let our virologist team to do their best to identify the antigen of this virus in their lab. By the end of January, we were able to identify this COVID-19 by using the RT-PCR technique. We set up these services to detect the nasopharyngeal swab for the COVID-19 in late February. Around early March, that we begin to have more and more cases. We decided to do the service to screening this antigen of the virus 24 hours. In some day, we have to do the screening test for this RT-PCR more than 1,600 cases a day.
To reach the goal of minimizing the number of new infected cases, we had to stop the viral spreading. Still, in March 2020, the number of cases suddenly rose up from a cluster at boxing stadiums and nightlife entertainment venues. There were more than 100 new cases each day. Eventually, medical supervisors from Mahidol University, collaborating with other leading organizations, recommended we implement measures to stop transmission, which later on, leading Thailand lockdown policy in April. During the lockdown, the virus detection was still continued, but collecting samples from people put medical professionals at risk of getting the virus. Therefore, alternative sample collection was implemented to minimize the risk.
To collect the nasopharyngeal swab, staff have to wear the PPE. They have to put the small plastic tube into the nose. This one is make irritate to the suspect case, then may spread the virus to the collector. We try to find the alternative sample collection method to collect the sample to test with the COVID-19. The previous report, they show that saliva can be used to test another respiratory tract infection, for example, influenza virus. Then we decided to do the research, compare between the saliva and nasopharyngeal swab. The result also show that the sample of the saliva and nasopharyngeal swab get high accuracy, about 80%. Then we apply to use the saliva as the screening specimen for the student that want to go to the school and the staff that want to go to work.
Moreover, there were methods developed and sought out which were easier and cheaper to detect the virus along the way.
The magnetic bead RNA extraction kit and the COVID-19 XOM colorimetric detection kit. RNA extraction method using the magnetic beads for the COVID-19 XOM colorimetric detection kit. This technology is a qualitative test based on a colorimetric loop mediated isothermal amplification or LAMP assay and use of the signal orange as the indicator for the detection of the SARS-CoV-2 RNA extracted from the clinical specimen of the suspected person of COVID-19, with appropriate for the surveillance application with the limited access to the centralized laboratories. And this test has 100% specificity, 92% sensitivity, and 97% accuracy.
And for the sake of accuracy, housekeeping gene detection was adopted in order to assure the test results.
Actually, housekeeping gene is a novel innovation. Housekeeping gene refers to the host gene which has been commonly used as the internal or endogenous control in molecular technique. We always combine this housekeeping gene testing with the molecular diagnosis of viral diseases. So this can help to avoid the false negative result because of inadequate specimen. Back to the April, when we established our molecular diagnostic lab for detecting SARS-CoV infection, we realized that most commercial kits did not provide the housekeeping gene control in the reactions. Therefore, we decided to add the housekeeping gene testing with SARS-CoV gene testing to make sure that we can report the true negative result.
During the lockdown, testing continued. The Faculty of Medical Technology at Mahidol University, in collaboration with the National Health Security Office, NHSO, performed proactive surveillance testing in vulnerable populations such as those in confinement, slums, and homeless people who are susceptible to getting viral infection.
The Faculty of Medical Technology has a very good chance to work with the National Health Security Office to provide proactive testing for the vulnerable groups such as the homeless people in various communities and the prisoners in jails located in Bangkok and neighboring provinces. It is known that the homeless people may have high risk of COVID-19 infection due to the high possibility to expose to the disease, as well as the lack of opportunity to access to the health service system. For the prisoner, it should be the best to prevent the dissemination of COVID-19 from the newcomer to get into the jail, since it is a closed and crowded area. Our findings reveal that the governmental policy is very effective to control the spread of infection, in which there is no significant evidence of disease dissemination among the homeless group. We think we are on the right track since in September the 2nd, we have found that one of the prisoners got infected with the SARS-CoV-2. During that time, that was the first case of domestic infection in Thailand after 100 days of disease-free. In this case, control of the disease can be done immediately, in which no consequence was observed either in the jail or in the community.
Mahidol University also supported communities by facilitating the local government body of the community to create its local quarantine system to prevent the spreading of COVID-19 in communities. One example was in the Sung Nun district of Nang Konratesima province.
The university expects us to support any of the programs that can help in minimizing the burden of COVID-19. So as the Faculty of Public Health, what we are keen of doing is trying to work with the community. We are talking about the whole district as the social determinants of health. So once the COVID-19 became a problem, the first problem that we have to encounter is the feeling of the people, whether they believe it, how to get them to change their behavior. We know the guideline and we know the community. So we are the middleman to translate the policy to be relevant to the people and the culture of the people in that community or in that area. The village health volunteer, before the COVID-19, some of them been trained to convey the message from the training. So we recognize that some of those messages not relevant to the context and to the feeling of the people. And we asking those who have the problems, those village health volunteers to come together and enhancing their skills in accessing the information, analyzing and comprehend the information that they should take into consideration before they make decision. And once the guideline, the policy regarding the COVID, this group of people start to share, information, different information that being spread from the government, from the people who just put in the line group. They're able to analyze and take the tips of what to prevent, how to do it. So wearing mask, not to go out, and cleaning hands often became the key issues that people start practicing. With that level of culture being stimulated by the Peer for Progress network, people willing to follow because they feel the caring.
For care of COVID-19 victims, medical personnel provided their best patient care with different stages of disease severity. At Mahidol University, the cases with severe problems were treated at these two super tertiary care hospitals, Sirira Hospital and Ramatiburi Jakri Narubudin Institute branch of Ramatiburi Hospital.
Because of it's a novel disease, we don't know how aggressiveness of the virus, how infectivity, how easily that the virus can spread. What is the treatment of choice? We don't know. And the manifestation of the COVID-19 pneumonia different from other pneumonia that we encountered in the past. From the information that released from China, the patient who developed COVID-19 pneumonia, that's allowed 50 to 60% of the patient develop pneumonia, but only 5 to 10% of them develop severe pneumonia. That means that your lung become from black lung, it become whitish lung, and then you cannot breathe by yourself. That is a severe pneumonia with respiratory failure in medical terms. During 6 weeks of caring moderate to severe case of COVID-19 pneumonia in Sirira Hospital, we encountered 106 patients. 15 of them, or around 10% of them, developed severe pneumonia requiring intensive care monitoring during that period.
We need to set up the new ICU system for COVID patients. Then we change the ICU ward, which comprise of AIR or X negative rooms into COVID ICU ward. We set the small team for each patient. One team comprised of 1 to 2 doctors, 1 to 2 nurses, assistant nurse, and so on, according to clinical situation. Then we can limited the use of PPE, limited the use or limited the number of re-entry out and in from the AIIR. As a result, we can provide effective treatment not only for the good point of care regarding the patient's care, but also we can limited number of PPE and prevent the medical personnel infections.
In terms of medical care, they separated the COVID-19 patients from other types of patients. The Faculty of Tropical Medicine set up a satellite acute respiratory infection (ARI) clinic to detect the virus and take care of those infected in isolated locations.
During the early outbreak of COVID-19 in Thailand, we implemented many strategies to handle COVID-19 at the Bangkok Hospital for Tropical Diseases. We established ARI clinic that was separate from the main hospital building to screen PUI patients. We allocated a private ward for admission of the PUI and COVID-19 infected patients. This strategy was designed to prevent the transmission of COVID-19 to other patients and the healthcare worker.
Because COVID-19 is spreading from respiratory droplet, and we don't want this disease to contaminate to our patient inside the building and also to our healthcare worker that work in the building. So that's why we set up the AI clinic before the first case of the COVID-19 was announced in Thailand. We have 2 examination room, nurse and for doctor to working in. We fully equipped with all the necessary thing to diagnose. And we also have another room for the patient, like if you need injection or if you need special care, such as the blood examination, we also have the special room for this kind of a patient. After we examine the patient in AI clinic, if we confirm the positive for COVID-19 cases, we have to admit the patient inside the hospital. So that's why we closed entire 14th floor as a cohort ward.
The same policy is implemented at Faculty of Medicine Ramatiburi Hospital, using Ramatiburi Jakri Narubodin Institute as a sanatorium for COVID-19 patients.
After we try to create the sense of urgency to our staff is to build a leading team. The leading team or the guiding team is the administration team of our hospital. And due to the uncertainty of COVID-19 operation, we need to amend some function of our leading team to make we work fast and more accurate. I set up a short-term goal for them, such as we will open around 30 beds from 122 beds to make them feel that this work is not too difficult. So when they success to open 30 beds, it's easier to open them all.
Confinement of the COVID-19 transmission with a lockdown policy made the number of COVID-19 patients dramatically decline. So the government began partially loosening the lockdown so people could gradually return to their normal lives.
We try to reduce the number of new cases. We call it the hammer strategy. Use the hammer to lower the number of new cases. When the number come down nicely, there's one parameter that used to be evaluated before we decide to call the dancing strategy. Allow people to do some activity so that to reduce the stress, to improve the financial or the economics of the country. This parameter was called R0 or R0. R0 come from the contact ratio, how many patients that you're going to contact each day or each time. If you stay home, the number is 0. Every time when you leave home, the more the people you contact, the higher risk you're going to harbor the virus. Or even if you have the virus, you're going to spread too. If you use the face mask, if you keep physical distancing, if you clean your hand, there's a marked reduction in the chance of probability to get the virus or to spread the virus. So we decide to explain this to the public. I think it worked because after this combined with the state of emergency that the government declared and also the curfew, we reduced the number. Initially the R0 was about 2 in Thailand, was around 2. We reduced it to about 0.7.
Meanwhile, people are still being encouraged to abide by the recommendations very strictly to halt the infection.
Early May, the government decided to do the dancing strategy to open some activities. And we suggest to the government that we agree, but we need to evaluate. Every time when we implement this dancing strategy, we have to evaluate. So the government agreed with us to monitor every 14 days. Every 14 days, if there are no increase in new cases, they go into the phase 2. We move toward until the phase 6, that we open almost all the activities. The number of new cases are almost 0. We have some new cases, but all of them were in the state quarantine. And there's something happened in July or August. There are some the pilot from Egypt, and they come to Thailand, and then they escape all this regulation, and then they spread out. Although we can control, we are lucky enough that there are no spread of the infection, but we realized at that time that most of the Thai, they are still concerned about the safety, but because of the very low number of the new cases, so they decide not to use the mask, they relieve themselves. We here in Mahidol, we send off some warning into the social media occasionally, try to convince people that you should not be in the comfort zone. Although there's no number, but there's a high risk of we're going to have a second wave.
In addition to providing care to COVID-19 patients, it is also important to maintain a high standard of care to non-COVID-19 patients.
By the time that we have to lock down the country, we have lots of problems with the non-COVID-19 patients like the diabetes, coronary heart disease, or the patient with the cancer, because they cannot come to the hospital to receive the general treatment. Therefore, we developed the telemedicine by using social media like the Line, Zoom, or with the Microsoft Teams to get access to the patients at home. We send all the medication via the post office, and we found that this way is quite nice because the patients need not to travel. And during the pandemic, then we locked down the country. We do these outpatient cases, more than 7,000 cases.
The Peer for Progress, as part of the non-communicable disease group, that able to change them from following the doctor's guideline into accessing information themselves and try it themselves by using the information that they have analyzed. Once they have applied it, they able to show the outcome, and we support them with the outcome like the blood tests or the improvement of their health. This is a way to empower them. During the COVID-19, the lockdown stage had made them plan of how to live within the household. They even predict that their glucose level might be increased, and they plan how to reduce it, and they're able to do it. They even plan to change their daily activities. Once we confirmed with them, within 23 days, they're able to manage it. This is help reducing the cost of healthcare, the cost of transportation. And they do it, continue doing it because they want to be safe and healthy.
Another factor that enables effective care of COVID-19 patients is the development of medical innovations to support services by specialized personnel of Mahidol University.
So first, during the time that we concerned about the virus and regarding to the vaccine, we also have the project that immediately they create to help the people to make the vaccine. That's what we call AI immunizer, which is using the robot kind of automation to help during the process. This one that will help to make the vaccine safer and also faster. Other thing that we also developed during the time based on the technology that we have, such as we have the robot that actually work in the industrial part, like a robot that work for deliver the things. So we have the project that actually work for our hospital to separate the patients and also the healthcare personnel by having the robot to bring in the food and also drug from one place to another place. So this will reduce the possibility that healthcare personnel will involve directly with the patient. This is what we call foodie. And also at the same time, we have another robot, which is a mobile robot also. It's a Westie that actually help to carry the bin or the waste from the patient's area that has a possibility to be the problem like a virus infection or something.
In addition, the Faculty of Science and Faculty of Ramatiburi Hospital, Mahidol University, in collaboration with Thailand's Center of Excellence for Life Sciences, TCELS, have been developing antiviral medication made from natural extracts and Thai herbs, which are common ingredients in our food on a daily basis. The results showed that fingerroot, Chinese ginger extract, has potential therapeutic effects against SARS-CoV-2.
It has been about a year that we spent a lot of effort working on the COVID-19 research, particularly on drug discovery part. The first success was from the isolation of the live SARS-CoV-2 virus and with the BSL-3 laboratory. Realization of this initial success, we in the same time collect hundreds of bioactive natural products that available in Mahidol University. Then we combine the two things together and we found that at least 3 crude extracts, the fingerroots, the ginger and andrographis are active against the live virus without damaging the good cells. They were working with low cytotoxicity. So that was the first success that the crude extract from at least 3 plants could lead to potentially future drugs that against the COVID-19.
Well, because of the Mahidol University, we have our strengths in life science and medicine. So many staff has expertise in several subspecialties and can provide the knowledge and carry on the research and develop many medical innovations to support such kind of crisis. So we applied with the how we can engage or contribute to such serious crisis in our country. And as we understand that our motto, the success of the learning process is not in the learning only, but in the contribution to the benefits of mankind. And this time we had contributed a lot to our people in domestic level and also in global regions to provide knowledge, sharing the idea, wisdom in resolving the pandemic condition. And our country has been recognized one of the best country that has capacity to handle such kind of COVID-19. So we are proud that we are one of the institutions that contributes to this kind of success.
The success of the crisis response Thailand has launched against COVID-19, from which Mahidol University, conjoining with many organizations, has earned praise from the World Health Organization, WHO, as a successful model for containing the spread of COVID-19. This work results from the united collaboration between doctors, faculties, and all staff at Mahidol University, who act in accordance with the philosophy of Prince Mahidol, which states, "True success is not in the learning, but in the application to the benefit of mankind."